This is you. You're happy. Life is going well. But recently, a big change has affected you, your family, and your future. You've been diagnosed with a serious disease. Your doctor gives you the option of a genetic test that could help improve your medical care. This survey is about your desire to take these tests. You've got a lot to think about. You're faced with a complex choice that will affect your life, your family, and your finances, on top of an already serious recent diagnosis. There are 6 key factors to consider in choosing whether to receive these genetic tests. The first factor is the type of information produced by a genetic test. Genetic tests can provide information that may help with your current disease, such as a specific medication or a change in the treatment you're already receiving. Genetic tests can also provide information that may help with future health issues, such as screening whether you or a family member are at risk of someday developing a new disease. Finally, a genetic test can provide both disease screening and treatment change information at the same time. The second factor to consider is the probability that you have a genetic marker of interest. For example, a 30% probability means that out of 100 people like you receiving the test, 30 will have a genetic marker and 70 will not. The third factor to consider is whether medical experts agree on what to do with the results of the test. Depending on the genetic marker, most, all, or only a few medical experts may agree on what to do next. A fourth factor to consider is the change to your health and ability to function. Your disease may impact your memory, your ability to care for yourself, or even your ability to communicate. A treatment change due to genetic testing could cause an improvement in one or many of these areas, or it could result in no change at all. Fifth, genetic testing that leads to a change in medical care could impact how long you live. However, the amount of change is often uncertain. While one treatment might have an average increase in life expectancy of a year, the actual change could range anywhere from a loss of 6 months of life to a gain of 2.5 years of life. A different treatment may also have an average increase of 1 year, but only range between a gain of 6 months to a gain of 1.5 years. How would this uncertainty affect your decision? Finally, there may be a cost to you for receiving these tests. As you cope with an already serious recent diagnosis, how will the cost impact your life? How will it affect your monthly budget, your savings, or your family, including your ability to do or purchase other important things? To sum up, the 6 factors to consider in whether to receive genetic tests are the type of information from a genetic test, the probability you have a genetic marker of interest, whether medical experts agree on medical care change, the likely change to your health from a medical care change, the impact on the length of your life from a medical care change, and the cost to you of receiving the test. Please consider these factors carefully as you complete the survey.